Today, we're tackling something really fundamental, this deep connection between our bodies, our minds, and maybe even spirit.
Exactly. We're looking at sources, mainly from osteopathy,
Mhm.
that don't treat these as separate things at all.
Right, they see it as physical, something you can almost touch.
That's the goal.
Hmm.
Our mission here is to really get into this body-mind interface. How does your life story, your emotions, your thoughts, how do they actually get woven into your physical self? Your muscles, your posture?
Your tissues.
Yes, exactly. We're exploring how you, as a person, are this integrated unit.
Hmm.
And for you listening, understanding this could be a real shortcut to, well, to finding better balance and functional harmony.
And this isn't a new idea, is it? It goes way back. You mentioned A.T. Still, the founder of osteopathy.
He defined health as wholeness or completeness, not
Mhm.
just, not being sick.
He used that phrase, triune when complete. It sounds quite philosophical. What does that mean in a practical, clinical way? What's the spiritual body here?
Yeah, it can sound a bit abstract. But Still's point was we have to look beyond just the nuts and bolts, the anatomy. Being triune body, spiritual body, and mind spirit, it's really about vitality.
Okay.
The spiritual body isn't necessarily religious dogma. Think of it as your innate healing power, your body's ability to self-regulate, that life force. Health, for Still, was about aligning with that, with nature's way of working.
Right, finding that harmony. So, okay, let's unpack that. If the goal is this balanced vitality, how does a practitioner actually help someone get there? How do you go from philosophy to, hands-on work?
Well, the clinical aim is always to restore the function of the physical body, the vehicle, you could say,
Yeah.
so that this innate well-being, this balance can flourish.
So the body can do its job properly.
Exactly. When body, mind, emotions, spirit, when they're all in sync, you can function at your best. The body wants to heal itself. Osteopathy tries to remove the obstacles.
Okay, that makes sense. But then the sources bring in this term, balanced ligamentous tension, BLT. It sounds quite mechanical structural. How does that fit with the idea that our psyche, our mind, is part of the tension?
Ah, yes, BLT. It sounds technical, but it's really about listening to the tissues. It's not about forcing anything or judging the tension.
Yeah.
It's more about acceptance.
Acceptance.
Yeah. When a practitioner uses BLT, they're feeling for these lines of force, these strain patterns in the body. They come from physical impacts, sure, but also from, past events, old injuries, emotional holding.
So present forces and history all mixed together.
Correct. The idea is to gently guide these converging forces to what's called a neutral point.
A neutral point.
Yeah.
What's that like? What does it feel like?
It's this point of equilibrium,
Mm-hmm.
where all the pulling forces balance out perfectly. It allows the tissues to just pause, and in that pause, they can reorganize, release the strain almost effortlessly.
Yeah.
And that's why the psyche is key, because the sources say it's inseparable. Your emotional history, held as physical tension, has to be part of that release, that resolution at the neutral point. Your past conflicts are right there in the tissue.
So the body is literally like an autobiography, written in tissue. And we even talk like this, don't we? Our everyday language reflects it. The sources call them body metaphors.
Oh, absolutely.
Oh,
We
uh-
constantly give the game away with how we speak.
Yeah,
You say you have a gut feeling, right? Or, I couldn't stomach that.
that's a physical sensation.
Totally visceral. Or feeling armored, like you're bracing yourself against something stressful. Or stabbed in the heart, or hit between the eyes. These aren't just poetic phrases. They often describe actual physical states of tension or shock.
And where does the body physically hold that bracing? The sources seem to really highlight fascia. Connective tissue. Why fascia? Why is it described as having its own language?
Fascia is crucial here. It's not just packing material around muscles and organs. It's this incredibly complex web that connects everything. And it's loaded with nerve endings. It's highly responsive
Responsive how?
to pressure, both physical and, it seems, emotional. It acts like this body-wide communication network. A sensitive practitioner, the sources suggest, can get a palpable sense, like they can feel the psyche permeating the body just through the state of the fascia.
Wow. So it's not just emotions affecting the body, they're physically stored there in this fascial matrix. Trauma, stress, even just ongoing chaos, it leaves its mark.
Exactly. Life hidden in the tissues, as one source puts it, sometimes for years after the event. So when you treat the physical strain, you're often bumping up against the emotional component that's locked in there too. You have to address both.
Which brings us to this idea of embodiment, parts of the body feeling uninhabited. Can you paint a picture of that? What does an uninhabited sacrum feel like to a practitioner?
It's a really interesting concept. Imagine a room in a house that no one's entered for years. It feels kind of cold, maybe dusty, resistant.
Okay.
When someone has psychologically withdrawn from a part of their body, maybe due to trauma or chronic pain there,
Yeah.
that area can feel, well, like that. Structurally resistant, maybe a bit numb or lifeless.
Hmm.
The sources use that striking phrase, feeling like no one at home in that area.
Like the person's awareness isn't fully there.
Precisely. They've pulled back their vitality from that spot as a coping mechanism.
Mm.
Part of the therapy is gently encouraging them to sort of move back in and re-inhabit that part of themselves.
That really changes how you think about healing. Okay, let's shift gears a bit. We need the science to back this up, right? If
Mm.
the mind affects the body so directly, what's the biological mechanism? Where's the hard evidence?
Right, the reciprocity. A lot of validation comes from psychoneuroimmunology, or PNI, especially the groundbreaking work of Candace Pert.
What did she find?
She discovered that the chemicals running our brain and emotions, neuropeptides, and their receptors, aren't just in the head. They're everywhere, throughout the body, in your immune cells, your gut, your tissues.
So the molecules of emotion are body-wide.
Exactly. It means the brain isn't separate. It's integrated into the body right down to the molecular level. It's one system reacting all at once.
That explains how fast emotional stress can show up physically.
Absolutely. Think about sudden stress or fear, that fight or flight response.
Yeah.
The sources mention how this can cause a literal downward drag on the pericardial attachments.
The pericardium, that's the sac around the heart. Why would stress pull it down?
It's that surge of sympathetic nervous system activity. It causes this whole body bracing, a contraction. And because the pericardium is physically connected to your diaphragm, your sternum, that tension pulls downwards.
Okay.
And if that becomes chronic, that constant downward pull can actually contribute to a slumped posture, pulling the upper back into more of a curve, a kyphosis. It physically embodies that feeling of being burdened or weary or full of grief. The emotion shapes the spine.
That's a really clear structural link. And the nervous system affects breathing too, right?
Oh, definitely. Your breathing pattern is an immediate giveaway. Short, shallow, maybe trembling breath often signals anxiety or fear. Slow, deep, easy breath. Usually peace, contentment.
And you can work the other way around. Treat the body to calm the mind.
Yes, that's the beauty of it. If someone's stuck in that high-stress sympathetic state, physically treating the areas related to the sympathetic nervous system, like along the thoracic spine, can actually help calm the whole system down.
Right.
Reduce the mental and emotional load by working with the body.
Treating the body changes the mind. Mind changes the body. It's a loop. What about things like mindfulness or meditation? Can we see physical changes in the brain from those practices?
We can, and it's pretty compelling evidence. Brain imaging studies show that regular meditation practice actually changes the brain's structure.
Really? How?
It tends to shrink the amygdala, that's kind of the brain's fear center, and increase the size of the hippocampus, which is important for learning, memory, and emotional regulation. So just paying attention differently literally reshapes your brain towards resilience.
Incredible. Okay, so if the body is that sensitive, even moment to moment, to our thoughts, what about the therapeutic environment itself? How does the interaction between the patient and practitioner actually affect the physical tissues?
That's a huge part of it. The sources are clear. The body is noticeably imprinted by thoughts, not just big traumas, but everyday thoughts.
Or self-criticism?
Yes, a patient's internal negative self-talk can be immediately palpable to a sensitive practitioner. You can feel the tissue subtly tighten or change quality as the thought passes through their mind.
Wow.
And the reverse is true too. A feeling of hope or safety or connection can create a palpable sense of release or flow in the tissues.
So your own self-criticism is literally felt in the practitioner's hands. That puts a lot of responsibility on the words used during treatment, doesn't it?
Absolutely immense.
Yeah.
Dr. Steele really hammered this home. He basically said, your words have power you can't even imagine. He advised practitioners to find any hope for his recovery and make that your report.
Because the body is listening?
The body is listening and responding. It's a clinical necessity to foster hope and positivity.
Which leads to creating a safe space. The idea of unconditional positive regard comes up.
Yes, that term often associated with Carl Rogers. It just means meeting the patient where they are, without judgment. Creating that safe, accepting space is often therapeutic in itself. It lets the patient lower their defenses and allows their own natural healing ability, their innate potency, to come forward. Sometimes healing happens just because someone is truly listening and accepting what's being expressed.
And it's not just about the techniques, is it? Roland Becker talked about the practitioner needing inner development.
Right. Becker really emphasized that treating someone isn't just applying mechanical fixes. It's participation in the experience of a living being.
Hmm.
You need empathy. You need to connect beyond just the anatomy charts. You're engaging with a whole person.
This has been quite the journey into the body. If we step back, the big picture seems to be the body isn't a machine. It's more like a living, breathing record keeper.
Dynamically integrated.
Right. Our emotions, our thoughts, how we talk to ourselves, even how we breathe, it's all constantly shaping our physical structure. And understanding that opens up totally new ways to think about health and healing.
It really does. And it connects this modern science back to older wisdom. You mentioned Keats calling the body the veil of soul making. The science of PNI, the clinical insights from osteopathy, they kind of validate that deep connection, that somatic reciprocity.
Absolutely. And for you listening, the relevance is hopefully pretty clear. If your body is always reflecting your inner world, just becoming aware of what that stiffness in your shoulder or that tension in your gut might actually be saying, that awareness is a huge first step. It's about aligning with those nature's truths we talked about earlier.
So maybe a final thought to leave you with. Consider some physical sensation you often experience. That recurring ache, that tight spot, that posture you can't seem to shake. Could it be reflecting an emotion or an old stress you haven't fully acknowledged? What might that physical pattern be trying to express? And, what might shift if you just listen to it?